Okay, in the previous video we have already studied about birth control. So there are the method. So method like barrier method, physical, chemical, and combined. This all we have studied, discussed already in the previous. So today we will discuss about the uh, terminal method. So in the terminal method there is a method that is known as sterilization, actually surgical method. In the terminal you have to know it is a surgical method. So these are the terminal and permanent method which block the transport of gametes, thereby preventing conceptions effectively. So in male, a small part of, remember, vas deferens is removed and tie up to a small incisions on the scrotum, and this is called vastomy. You have to remember. In female, a small part of the fallopian tubes, remember, fallopian tubes is removed. In male, vas deferens, and in the female, fallopian tubes is removed and tie up through a small incisions. So and this is called tubeotomy. So this is sterilization method. It's coming under the term. It's a permanent method actually to control birth control. So there is one medical termination of pregnancy, MTP. So remember, this is MTP. So it is defined as voluntary termination of pregnancy before full term. So MTP was legalized by Government of India in 1971. So it is to avoid misuse. So MTP is done in the following situations. So remember, medical terminations of pregnancy. So failure of contraceptive use during coitus, and when continued pregnancy is harmful or fatal to either mother or fetus or both, or in the rare case, and it is said during first trimesters, that is first week of the pregnancy. So this is the MTP methods. So remember, in 1971 it's under a certain condition is there, so that this method can be applied. Now, sexual transmitted disease, so STD. So there are infections or diseases that are transmitted through sexual intercourse, and that is known as STP. So, or also known as VD, that is venereal disease. So these early symptoms like itching, fluid discharge, pain, and swelling in the genital regions. So this is complications due to chronic STD, like pelvic inflammatory disease, abortions, stillbirth, ectopic pregnancy, infertility, or even cancer of the reproductive tract. So transmissions of hepatitis B and HIV. So these are the disease name actually. The sexual transmitted disease. We'll look these. These are the infectious disease, STD disease, AIDS, syphilis, gonorrhea. So and these are the causative agents. So these are the transmitted sexual transmitted disease. So by following simple principle or method can be prevented the disease, like avoid sex with unknown partners or multiple partners. Always use condom during coitus. Contact a qualified doctor for any doubt in early stage of infections. So infertility. So what is infertility? It is a inability to produce children in spite in unprotected sexual. Like birth control is like, some are there. Some couples are there who cannot give. But so there is a like infertility, they cannot fertility. So the reason of infertility could be physical, congenital disease, drugs, immunological, or even psychological. So specialized healthcare unit called infertility clinic under diagnosis and corrective treatment can be done for this disorder, infertility. So infertility couple could be assigned to have children through certain special techniques are there called like assisted reproductive technology, that is ART. So which are given below. Look this like test tube baby programs. These are the method test tube. So infertility couples can be take the children. In this method, ova from a donor or wife and the sperm from the husband or are collected and induced to form zygote under simplest conditions like in a laboratory. These things happen in a laboratory. So this process is in vitro fertilization, that is IVF. Remember, IVF, in vitro fertilization. So the ova and the sperm from the husband and wife is collected and induced to form a zygote, and it's happened in a laboratory. So similarly, the zygote or early embryo which set up to 8 blastomeres in the fallopian tubes, and it's called zygote intra-fallopian transfer, or ZIFT. To remember, ZIFT. So an embryo with more than 8 blastoma is transferred into the uterus. The process is called IUT, intrauterine transfer. So this is the method. And in female who cannot conceive, embryos formed by fusing of gametes in another female also in vivo are transferred. And then the lady get pregnant. So like there is GIFT. So it is transferred from an ova collected from a donor into fallopian tubes of another female who cannot produce one but can provide sustainable environment for fertilization and further development embryo. So gamete embryo fallopian transfer. So there are other methods also like intracytoplasmic sperm injection, artificial insemination. Like artificial, like it is method of semen collected either from the husband or a healthy donor in artificial introduced into a vagina or into the uterus. So intrauterine inseminations or IUI. So this technique is used in case where the male is unable to inseminate sperm in the female tract due to very low sperm count in the ejaculation. So these are the methods you have to know in this chapter.